I want you to hear my voice.
I want you to hear my voice.
I want you to hear my voice.
EleVATE stands for Addressing Depression, Toxic Stress, and Equity through Group Prenatal Care. So through EleVATE, you have this group prenatal care program that is one-stop shopping. You come and you get all of your prenatal care in a group setting with women of a similar gestational age. But embedded in that, you also get mental health needs addressed.
What's different about EleVATE? It offers a different experience and an approach to overall holistic health for Black and brown birthing people. Trauma-informed care, and that's something that you don't always get when you go into a 15-minute doctor's appointment.
Having somebody to talk to is the most important thing. Baby's health, your health during pregnancy, making sure everything is going appropriately.
I don't think a lot of us are aware about mental health, especially the Black community.
Mental health is a part of the whole person that needs care, just like your blood pressure would need care.
We all need someone to talk to about the things that we're thinking or we may be going through.
And tune me more into myself and the baby as well as other mothers, comparing notes and stuff, and just to know that it's someone else out there with possibly the same problems as I have.
Looking at the needs of Black and brown moms living in, for the most part, the inner city of St. Louis, group prenatal care is an opportunity for patients and providers to come together and talk about pregnancy-related topics in a group setting. So we want the environment to be super welcoming for everybody who comes.
It is a group that you also have the support, the voice, the experience of the women, kind of also melding in the medical and behavioral health, trauma health piece, and I think that's powerful.
My mental health, it was okay, but at the same time, I basically was screaming out for attention. I'm doing this again and not ready at the moment.
My parents passed away when I was 21. My daughter, she doesn't know that yet, but I'm worried about when that conversation comes. If you're not mentally sound, how can you really give birth to a baby and expect to be okay?
We can't have healthy babies without healthy moms, and moms can't be healthy if we're not also viewing their mental health.
It's not always physical. It's definitely mental, sometimes environmental.
I always thought it was about death or, losing something that was close. I found out in class there were other ways of trauma.
It could just be anything that just take a toll on you, I would say.
Those experiences over time really kind of color how you see the world and how you are going to interact with people.
A big way I would define trauma are things that are present in our city and in our country, like racism. And it affects our health, especially during pregnancy. It can really cause problems if we don't manage it.
Race is something that needs to be considered. It influences people. It influences how we think about people, how we approach people.
It also means recognizing that there may be parts of our healthcare system that make her feel like she's at risk of being traumatized again.
The community voice aspect of that has been so powerful. It has really changed my approach to my other work.
Really took it as a time to really think about the connection between racial equity and healthcare and how that can eventually make an impact on infant mortality and preterm birth and low birth weights.
Racism kills. And so we were very mindful of making sure that we centered equity and looked at our work through a racial equity lens. EleVATE was created by and for Black women. The patients really had the most important voice at the table.
As a patient, it became a partner, and offering my community voice has helped shape healthcare, especially to Black and brown birthing people.
It changed the way I approach my whole research. Patients need more of a voice when we're thinking about the interventions that we want to provide.
Break down those medical barriers, social determinants of health that they may be experiencing. It's amazing to see how far it's come in 5 years with the help of so many community partners.
It has opened me up in so many different ways.
I can actually, help other people with the information that I know.
Being a part of this initiative has helped me and my family to grow stronger together.
It gives you some hope. It gives you hope that things can get better.
Join. You don't even have to say anything, it's join. We need you to come, join. This is what we all need as a community, whether you're Black, white, Asian, it does not matter.
I want you to hear my voice.
I'm listening and I hear your voice.
I hear your voice.
I hear your voice.
Escucho a tu voz.
I hear your voice.